Hello and welcome to my channel. We'll continue our talk about the cardiovascular system, so let's begin. Now it comes to arteries. As you all know, that oxygenated blood runs through the systemic circulation when leaving the left ventricle through the aortic semilunar valve to the aorta. Now, the first part of this circulation is the aorta, which is a huge artery with a very thick wall and high elasticity. It arches over the left main bronchus and gives three main branches: the brachiocephalic, the left common carotid, the left subclavian, to supply the upper part of the body. As it goes down, it gives spinal arteries, intercostal arteries, that supplies the ribs, intercostal spaces. Then it enters the abdomen through the aortic opening at the level of T12, where it becomes the abdominal aorta and continues to supply the abdomen and pelvis by its branches. The terminal branches are the right and left common iliac arteries. The walls of the aorta are, as mentioned before, are elastic. This elasticity helps to maintain the blood pressure throughout the body. The aorta, when receiving its blood, it recoils and is responsible for the pulsating blood pressure we all feel. The aorta also branches into smaller arteries. Their elasticity goes on decreasing and their compliance goes on increasing till we reach the venous side. The final branches of the arteries are the capillaries, at which the exchange occurs, and the arteries branch into smaller passages called the arterioles, and then the capillaries, and these capillaries merge to bring blood into the venous system through venules and then veins. See, artery, arteriole, capillaries, postcapillary venules, and then veins back to the heart. Veins are much thinner than arteries. As we mentioned, that the capillaries merge into venules, then merge into veins. The venous system converges into two major veins: the superior vena cava, which mainly drains tissues above the heart, and inferior vena cava, which mainly drains tissues below the heart. The two large veins empty into the right atrium of the heart. This is the superior vena cava, as you can see here, formed by the union of the right and left brachiocephalic veins, and the inferior vena cava, which is more prominent here, formed by the merging of the right and left common iliac veins. Of course, the direction of blood is upwards here, and the direction of blood is downwards in the superior vena cava. A special type of circulation called the portal circulation. We mentioned earlier that it's circulation between two capillary beds. Not from the heart to the body, but from two capillary beds. And the famous one is the hepatic portal vein circulation, which combines from capillaries around the gastrointestinal tract, where the blood absorbs the various products of digestion, and rather than emptying into the inferior vena cava, no, it empties in the sinusoids of the liver, for the liver to do its action in detoxification of all the absorbed material from the GIT. Then from the liver by means of hepatic veins, the clean blood now, after processed upon by the liver, is delivered to the inferior vena cava, to the heart. The hepatic veins usually have no extra hepatic course, so it's all embedded in the liver itself. The heart pumps oxygenated blood to the body and deoxygenated blood to the lungs. The oxygenated blood pumps through the left side of the heart, the deoxygenated blood through the right side of the heart, and the pumps comprise one atrium and one ventricle on each side. The right side is so that's a total of 4 chamber, left atrium, left ventricle, and right atrium and right ventricle. The left atrium and left ventricle are responsible for the systemic circulation. The right atrium and right ventricle are responsible for pulmonary circulation. And as you observe here, the wall of the left ventricle is much thicker than the wall of the right ventricle, because this needs more force because it provides provides blood to all the body. The blood, the deoxygenated blood, after being used by the tissues, passes into the right ventricle passes into the right atrium first, and then into the right ventricle to be pumped through the pulmonary artery to the lungs. And I told you before that the pulmonary artery is blue here because it has the structure of an artery, but it carries deoxygenated blood, so that's why it's blue. The lift to the lungs, right and left lung, and then the lungs, after exchange of CO2 and O2, returns the blood through capacitance veins, vessels with the structure of the veins, that is the pulmonary veins, but carries oxygenated blood. So the pulmonary artery carries deoxygenated blood, and the pulmonary veins carry oxygenated blood back to the left atrium of the heart, where the systemic circulation will start and being taken over by the left ventricle. Now the heart itself needs nutrition, and it gets this nutrition by means of the coronary circulation. It provides blood supply to the heart muscle itself. It begins near the origin of the aorta by the carotid, by the coronary sinuses that give rise to the coronary arteries, the right and left coronary artery. And after nourishing the heart muscle, the blood returns through the coronary veins into the coronary sinus. If you want more details about the coronary circulation, you can refer to its lecture in the thorax series. And coronary sinus empties into the right atrium. Backflow of blood through the opening of the coronary sinus during atrial systole is prevented by a valve called Thebesian valve, and the smallest cardiac veins found all over the heart, they drain directly into the heart chambers, so it's not possible to have a cramp in the heart, for example, for accumulation of lactic acid, because of the extensive venous drainage. The lungs, the circulatory system of the lungs, the part of the cardiovascular system in which oxygen depleted blood is pumped away from the heart via the pulmonary artery to the lungs and back to the heart via the pulmonary veins. The deoxygenated blood from the superior and inferior vena cava that open into the right atrium flow through the tricuspid valve. This is the tricuspid valve. It separates the right atrium from the right ventricle. So the blood flows into the right ventricle, and from the right ventricle through the pulmonary trunk into the right and left pulmonary arteries. And there is a valve here guarding the beginning of the pulmonary trunk, which is the pulmonary semilunar valve. Now, after arriving to the lung, gas exchange occurs. CO2 is expelled out and O2 is obtained from the air. The pulmonary vein returns the oxygenated blood now to the left atrium. The site for exchange is called the alveoli of the lung, and this is an alveolar sac with multiple alveoli in it, with capillary beds around it where the exchange occurs. Now there is another system to supply the lung itself for nutrition, known as the bronchial arteries or the bronchial circulation, that supplies blood to the tissue of the larger airways of the lung. Now, to talk about the systemic circulation, it's part of the cardiovascular system that transports oxygenated blood away from the heart, of course, through the left ventricle to the rest of the body, and returns oxygen depleted blood back to the heart. The brain, as an organ, takes a share in this from this circulation. And actually, there are double systems to supply the brain. It's called the carotid system and the vertebro-basilar system. The carotid system comprises the internal carotid artery coming from the common carotid artery of the neck, and the internal carotid artery that gives rise to the two main branches in the brain, the anterior and middle cerebral arteries. And this is called the anterior system, because the vertebral arteries lies within the foramina transversaria of the cervical vertebrae. So before entering the skull, they merge at the lower border of the pons to form the basilar artery that ends by giving the posterior cerebral arteries that supplies the back of the brain and the brain stem. These two circulations, or these two systems, the carotid system and the vertebro-basilar system, are joined together at what's so-called the circle of Willis. This is the circle of Willis, as you can see here. Communication between the two anterior cerebral arteries from the internal carotid, and by means of a branch called the posterior communicating artery to the posterior cerebral arteries. This is the basilar artery and the two vertebrals. This is the circle of Willis. Internal carotid, anterior cerebral, anterior communicating, anterior cerebral, internal carotid, posterior communicating, posterior cerebral. This is the circle of Willis. It gives numerous branches called the perforating branches that forms the perforated substance of the brain, and it supplies the internal structures of the brain, as the basal ganglia and the thalamus, for example. And it's a common site for aneurysms, because aneurysms are usually pick the sites of where the walls of the artery bifurcate, especially if it's tiny arteries. It also supplies the internal capsule. A study, you can review this in the neuroseries, the internal capsule that carries almost all the motor descending impulses from the brain to the body, and all the sensory ascending impulses to the brain. And that's why tiny portion of the internal capsule, if damaged by a damaged artery, it causes hemiplegia or paralysis. The kidneys, other organs that receive around 20% of the cardiac output. It branches from the abdominal aorta and returns blood to the inferior vena cava through the renal veins. The blood is filtered, as you know, in the kidneys to produce urine, and where absorption and reabsorption takes place in the renal cortex and medulla. And the unit of the renal function is the glomerulus, as you all know. Now, the clinical significance means the diseases of the cardiovascular system. They are called cardiovascular diseases, and many of them referred to as lifestyle diseases because they have intimate connection with the lifestyle of the patient. Exercise habits, the diet, smoking, and sedentary life, other lifestyle choices of the person makes. One of the common causes, or one of the commonest diseases, is the atherosclerosis. It's the precursor of many of the cardiovascular system diseases. It's where a small atheromatous plaques build up in the walls of the medium and large arteries, and it may eventually grow or rupture to occlude the affected artery. It's also a risk factor for coronary syndromes, anginas, for the narrowing of the coronary arteries. It's characterized by a sudden deficit of oxygenated blood to the heart tissue. Often the atherosclerosis is also associated with problems such as aneurysms or aneurysm formation and coarctation of the aorta, or the splitting, dissection of the arteries, especially the aorta. The aorta can also be affected. This is how an aneurysm looks like in a cerebral angiogram. See how big the aneurysm is. It may rupture at any time. This is a real tissue specimen of atheromatous plaque affecting the bifurcation of the common carotid artery into external and internal carotid arteries. See how it looks. Another major cardiovascular disease, it's a clot formation called the thrombus. Here you can see it here. This can originate in veins or arteries, especially the veins, by the way, because more stagnation of blood occurs there, and the commonest being the DVT, or the deep venous thrombosis. It mostly occurs in the legs, particularly when a person has been stationary for a long time. These clots may embolize, means parts of them detached and run with the blood to be impacted somewhere else in another location, and usually the lungs. It's the common cause of pulmonary embolism. So it's a very dangerous situation or case, the DVT. This is a picture of how DVT looks like. This is the affected leg. Notice the swelling and edema occurring in that leg compared to the normal circulation leg. Cardiovascular diseases may also be congenital in nature, and congenital means persistence of the fetal circulation, that is, the defects in the fetus persist after labor, and One of these defects is the atrial septal defect and ventricular septal defect. This is a case of ventricular septal defect, as you can see here, where the blood is shunted either from the left ventricle to the pulmonary trunk, or from the left ventricle to the right ventricle. So according to the case, this is a normal heart, how it looks like. So shunting means deficiency in the systemic circulation, and with some diseases, congenital diseases, the baby may turn blue. It's called cyanotic heart congenital anomalies. But not all congenital changes to the circulatory system are associated with diseases. A large number are anatomical variations, and maybe the commonest is the patent ductus arteriosus, where the ductus arteriosus, the one between the arch of the aorta and the left pulmonary artery, may persist, but it can be treated even by medicines like indomethacin. I hope you got the maximum benefit from this lecture, and thank you very much for watching.